So, good evening, friends. So, this session is to discuss the questions that were in the MRB session that happened on 5th of January 2025. So, this is like a different type of question where directly only one-liners will be asked. What are the questions that we are expected? The syllabus given was mostly focused towards the general surgical topics, but some topics asked which are very common in the UG syllabus. So what were those questions were? The first question is, which of the following condition can tetany occur? So how you can, even though if you do not know this answer, the point is tetany happens in hypocalcemia. There is only one condition out of these four options which can develop hypocalcemia. Because in hyperparathyroidism, calcium level increases both in primary and secondary. Even in multiple myeloma, the calcium level rises due to bone destruction. So this is after accidental removal of parathyroid glands. So this we had discussed in our MRB workbook session. Like what are the complications of thyroidectomy was most common complication is a temporary hypocalcemia rather than a permanent hypocalcemia. So here, if the all four parathyroid glands have been accidentally removed, and if you have found out during the intraoperative period itself, you just remove those glands specifically, and you can reimplant in the sternocleidomastoid muscle if you find out. But in the post-operative period, if the patient develops hypocalcemia, then the patient will be on lifelong supplementation for calcium and vitamin D supplementation. So this is directly a straightforward question. This hypocalcemia occurs due to removal of the parathyroid glands. Very important concept. Next, the most common type of shock present in trauma. This we have discussed very clearly in the first page of our MRP workbook session. This is directly taken from here. So the most common type of shock is always hemorrhagic or hypovolemic shock. So the answer will be direct question. It is a hypovolemic shock. Okay. We have mentioned here the most common type of shock that happens in trauma is always some kind of bleeding, whether it can be in the abdomen, it can be in the thorax, it can be in the cranium also. But massive head injury leading to a lot of blood loss can never lead to hypovolemia. Only reason is due to amputation of leg or hand, any vessel injury, or within the abdomen or within the thorax. Okay. Next, CRP is elevated in which of the following condition? So CRP is a inflammatory marker. So from these options, which denotes an active infection. So systemic lupus erythematosus is a autoimmune disorder, rheumatological disorder. Multiple myeloma is a malignancy. End-stage renal disease, something associated with kidney. CRP doesn't get elevated here. So there must be some acute inflammation happening in some part of the body. So it is necrotizing bacterial infection. So this we have not discussed directly. We discussed necrotizing fasciitis, what are the common causative organisms, what is Fournier's gangrene, and what is Melanese gangrene. These were the topics which we had discussed. But if you imply these implications, you will be able to answer such questions easily. Next, Hertel cells are prominently seen in. This is directly taken from thyroid chapter. So Hertel cells, always remember Hashimoto's thyroiditis. And other form of Hertel cells will be found in Hertel cell carcinoma, which is a variant of follicular carcinoma of thyroid. So this also we had discussed about Hashimoto's thyroiditis in our surgery topic, but Hertel cells, this was emphasized by Dr. Vimal in the pathology topic. So Hashimoto's thyroiditis is also known as chronic lymphocytic thyroiditis. It is the most common antibody we had discussed was anti-thyroid peroxidase antibody. It most commonly resolves by itself. But the complication which we have to remember for our further exams is always is a non-Hodgkin's B cell type of lymphoma followed by papillary carcinoma thyroid. So here the patient is mostly in a state of hypothyroidism. So the treatment will be just giving thyroxine supplementation, nothing else. Okay, it is a case of Hashimoto's thyroiditis. Next, Peutz-Jeghers syndrome. These are multiply repeated type of questions. So which is autosomal dominant, which is autosomal recessive, which is X-linked dominant or recessive. So how to remember is here, why in surgery this topic is important is colorectal polyps. So only one thing you can easily remember is all types of hereditary colorectal polyposis are always mostly autosomal dominant, except one condition, which is autosomal recessive, and that is MUTYH associated polyposis. Okay. And HNPCC, another condition where there is mismatch repair gene defect. So this we had discussed in our discussion, MRB workbook. This is a case of Peutz-Jeghers syndrome where there is melanosis, that is in hyperpigmentation in the mucous membrane of the lips, anal canal. Their mutation is LKB1 STK11. It is autosomal dominant, mucosal pigmentation, and multiple polyps in stomach and small bowel. Okay. Next, common hip location following dashboard injury. This I had not discussed in the latest ADR MRB video, but one video before we had discussed the common trauma chapter. Okay, so in this you can easily understand dashboard injury means direct impact over the knee. So what will happen? The hip joint goes towards posteriorly. So whatever impact happens here, this goes posteriorly. So it is a posterior dislocation. Okay. So we had discussed this patterns of injury. What is an obvious injury and what is a covert injury? So obvious injury means this knee injury becomes the, you can see here, becomes the obvious. And this is a hidden injury. So you should always rule out hidden injuries based on the mechanism of injury. So always ask the history of the patient, what is the nature of the injury and what is the mechanism of injury. Very, very important. What is the force that got applied? How severe or how greater the force? That is a very important criteria. Okay. And non-accidental injury also we had discussed. Next, the posterior wall of femoral sheath is formed by, this is question directly from anatomy only, but since we discussed femoral hernia in the previous MRB video, I have just taken some points which we had discussed. So femoral hernia, this was the anatomy which we had discussed. This is the femoral sheath, this part. This is the femoral sheath. Okay. So anteriorly it is the fascia transversalis and posteriorly it is the fascia iliaca, and the content is the lymph node of Cloquet or Rosenmuller. That is the content of femoral sheath. Okay. So the answer is fascia iliaca. Next, among primary parotid malignant tumors, the most common one is, this was also a question which I had previously asked in the MRB discussion video. This is directly taken from here. What is the most common primary malignant tumor of the parotid gland? It is always the mucoepidermoid carcinoma. Okay. Most common parotid tumor. See, how to remember in parotid is, it is mostly benign. So it should be, if they just ask parotid tumor, should be pleomorphic adenoma. So rest 20% can be malignant. Out of the malignant, it is the mucoepidermoid carcinoma. Okay. This was the question I had framed. So the exact same question was asked in your exam. Next, hepatic bile differs from gallbladder bile having all except. So how to remember easily is, hepatic bile differs from gallbladder bile. How to remember easily? What is the function of gallbladder? This is a question from physiology topic. But how to remember is, gallbladder has concentration of bile. So the water gets absorbed. So how does hepatic bile? Hepatic bile has more water content, but GB bile has less water content. But pH will never change. Solid nature, biles or bile pigments never changes. This is directly taken from Bailey only. Functions of gallbladder, you can see. An additional function is concentration of bile by active absorption of water. This is directly taken from Bailey only. So less water content should be the answer. Are you guys able to get it? Next, post-splenectomy pneumococcal vaccine should be given. So there is some controversy I heard along with my colleagues and my few of my friends who wrote the MRB, whether with this within 1 week or by 2 to 3 weeks. To clear this confusion, I have taken the exact images from Bailey and Sebastian. So this image is taken from Bailey. So here you have to see the point that such vaccination should be administered at least 2 weeks before elective surgery or as soon as possible after recovery from surgery but before discharge from the hospital. So there are two scenarios. One is elective condition, other one is an emergency condition. Here they have asked emergency splenectomy. And here in Sabiston, they have clearly mentioned should be ideally given 10 to 12 weeks prior to splenectomy or at least 14 days. Or if the patient did not receive these vaccines, should be given 14 days after splenectomy. So which means 2 to 3 weeks. I will go with 2 to 3 weeks to be the best answer here. Within 2 to 3 weeks, as given by the MRB answer key, the answer also remains the same. Next, TAO. This is a very direct question. Where does it get affect? It is also known as Burgess disease. Burgess disease, it affects the medium to small sized vessels. So here, veins get affected, arteries get affected, and even the nerves. It's a combined disorder. So arteries, that is medium to small sized. So this is right. Smokers, the most common etiology of TAO is always only smokers, young age. And there will be superficial thrombophlebitis. This is also right. So except means affects the large arteries will be the correct answer here. Okay, this is also directly from Bailey. This is small to medium sized vessels, thrombophlebitis of the superficial veins. And young male smokers. Very, very important point. Okay. Next, treatment for mastalgia. Here they ask the right answer. So what happens is there are two types of mastalgia. One is cyclical, other one is non-cyclical mastalgia. So what we'll see is what they have given in Bailey and Love regarding this topic. So in Bailey and Love, they have mentioned first reassurance and adequate support. The main treatment is always breast support, remember. Then you give evening primrose oil, anti-inflammatories, tamoxifen, danazol, and anti-estrogen like LHRH agonist. But here the options doesn't give any of these options. So which is the best option out of this? I have taken an article for treatment of benign breast diseases with bromocriptine. So the answer should be here is bromocriptine. Okay. Progesterone has nothing to do with breast pain. Only anti-estrogen drugs. Estrogen effect has come down. Ifepristone also is a progesterone drug only. Next, the dash keeps the cystic duct open to drain the gallbladder. So they have mentioned that this is the gallbladder and this is the cystic duct. What are the things that are present here? It is the spiral valve of Pfister. Eustachian valve is present in the heart. Sebacean valve is in the heart. SOD is found in the common bile duct. So it's a spiral valve of Pfister. So reference is directly from Bailey and Lowe 28th edition. You can see here. Cystic duct is 3 centimeters and the mucosa is arranged in spiral folds, also known as valves of Pfister. Okay. Next, last question. These two are anatomy questions, but closely related to surgery. That is why I put it under surgery topic. So Riedl's lobe is seen in. It is a question directly taken from Sabiston. The answer is liver here. So they have mentioned a tongue of tissue extending inferiorly of the right liver is known as the Riedl's lobe. So right lobe of the liver, there is some tissue extending downwards into the lower quadrant. That is known as Riedl's lobe. Okay. So these were the questions that were asked in MRB and the answer key was taken. And these were the topics that I had to cover. That splenectomy alone, there were some multiple controversies. I have shown the images and explained it in a correct way. So it should be 2 to 3 weeks post splenectomy or at the time of discharge. That is the most important point, whichever is earliest. Okay. So if the patient gets discharged on the 10th day, you can give it on the 10th day itself. But if most preferred is 2 to 3 weeks, 14 days after surgery. Okay. Thank you so much. Have a nice day.